Saturday morning. A man sits at his kitchen table, coffee in hand, newspaper open. He feels a little off, something in his left shoulder, dull, nagging. He rolls it a few times. Must have slept on it wrong. He finishes his coffee, goes about his day, mows the lawn, watches the game. That night, he mentions it to his wife. She says, "Take an ibuprofen." He does. 22 hours after that first twinge at the kitchen table, he is on a stretcher in the back of an ambulance with an oxygen mask over his face. Every 40 seconds, someone in the United States has a heart attack. Over 800,000 per year. And here is the part that should stop you in your tracks. In the vast majority of those cases, the body was sending clear, specific warning signals hours before the artery closed. The problem is that nobody ever taught you what those signals look like. Most people carry the same image in their head. A man clutches his chest, his face contorts, he drops to the floor. That is the Hollywood heart attack. And that image has killed more people than it has saved. Because the real warnings look nothing like that. They are quiet, they are strange, they are easy to explain away, and they often begin a full 24 hours before the event. To understand why the body warns you at all, you need to understand what actually happens inside the artery before it closes. Your heart is a muscle. And like every muscle in your body, it needs its own blood supply to function. That supply comes through the coronary arteries, two small vessels that wrap around the outside of the heart like a crown. Corona is Latin for crown. That is where the name comes from. Over years, cholesterol deposits called plaques build up on the inner walls of those arteries. For a long time, the plaque just sits there. The artery is still open enough for blood to pass. You feel absolutely nothing. Then something changes. The surface of the plaque cracks, it ruptures, it erodes. Your body treats that ruptured surface exactly like an open wound and sends platelets, the blood cells responsible for clotting, to seal it. A clot begins to form directly on top of the damaged plaque. As that clot grows, the already narrowed artery gets tighter and tighter. Blood flow to a section of heart muscle slows to a trickle. If the clot seals the artery completely, that section of muscle loses its oxygen supply and begins to die. That is a myocardial infarction. That is a heart attack. Here is the key insight. Plaque rupture and clot formation are not instantaneous events. They unfold over hours, sometimes over a full day. And during that buildup, the heart sends distress signals through the nervous system. Those signals show up as symptoms you can learn to recognize. By the way, if you or someone in your family is dealing with a health condition and you have been looking into new treatment options, Care Health connects you with clinical trials in your area. The link is on the channel page. Now, let me walk you through the specific warning signs, starting with the one people get wrong most often. Most people expect a heart attack to feel like a sharp, stabbing pain in the chest. Something dramatic, something obvious. That expectation is wrong, and it is dangerous. What the heart actually produces in the hours before a full blockage is usually not pain at all. It is pressure, tightness, heaviness. Patients describe it as someone sitting on my chest, a tight band wrapped around my ribs, a squeezing feeling behind the breastbone. It is deep and dull, not sharp and surface level. And here is the part that fools almost everyone. It comes and goes. It might last 5 minutes, fade completely for an hour, then come back. You feel it, you pause, and then it disappears. So you move on with your day. That intermittent pattern has a name: unstable angina. It means the plaque inside your coronary artery has ruptured, a partial clot has formed, blood flow has dropped, and then the clot shifts slightly and flow partially restores. The artery is opening and closing like a door in the wind. Every time it closes, you feel the pressure. Every time it opens, you feel relief. And that relief is exactly what convinces you nothing serious is happening. Now, most people at this point assume it is indigestion. Let me give you the difference. Acid reflux burns. It rises toward the throat. It responds to antacids. It is usually tied to a meal. Cardiac pressure sits deeper. It does not burn. It does not rise. Antacids do nothing. And it often appears with exertion or emotional stress, not after eating. If you feel pressure behind your breastbone that comes and goes over the course of hours, and there is no clear digestive explanation, that is not a wait-and-see situation. That is a get-evaluated situation. This is the warning sign that sends people to the wrong doctor entirely. Your heart does not just send distress signals to your chest. It can send them to your jaw, your teeth, your left arm, your neck, the space between your shoulder blades, even your upper abdomen. And when people feel pain in those locations, They think dental problem, pulled muscle, stomach bug. The heart never crosses their mind. The reason is something called referred pain. Your heart shares nerve pathways with other parts of your body through the spinal cord. When the heart is in trouble, pain signals travel along those shared pathways and surface in locations that seem completely unrelated to your cardiovascular system. Let me walk through them. Jaw pain from the heart typically affects both sides of the lower jaw. It comes on suddenly. There is no dental cause, nothing you chewed, nothing you bit down on. It often worsens with physical effort. Arm pain or heaviness usually runs down the inner side of the left arm, but it can show up in the right arm or both. People describe it as a heaviness, not a sharp injury. Like the arm is filled with lead, pain between the shoulder blades can feel exactly like a pulled muscle. You reach back, you try to rub it, and it does not respond to massage or stretching. Upper abdominal discomfort can mimic a stomach problem so convincingly that some patients end up in a gastroenterologist's office instead of a cardiologist's. The critical feature that ties all of these together is the absence of a mechanical trigger. You did not lift anything. You did not chew anything hard. You did not eat anything unusual. The pain simply appeared. And if it comes in waves alongside the chest pressure from the previous chapter, your body is not being subtle anymore. It is spelling out the message. This is the warning sign that gets missed more than any other, especially in women. In the 24 hours before a heart attack, many people experience a fatigue so deep and so sudden that it stops them in the middle of their day. This is not being sleepy. This is not having a rough afternoon. This is a crushing, bone-heavy exhaustion that feels fundamentally different from anything they have felt before. Patients describe it the same way almost every time. I felt like I had the flu without the fever. I could barely lift my arms. I had to sit down in the middle of doing something I do every single day without thinking. Here is what is happening inside the body. As the coronary artery narrows and the clot grows, the heart muscle receives less and less oxygen. It is still beating. It has no choice. But it is working significantly harder for significantly less output. Cardiac output, that is the total volume of blood the heart pumps per minute, drops. When cardiac output drops, every organ and every muscle in your body receives less oxygen-rich blood. Your brain registers that deficit as profound, whole-body fatigue. Your body is sending one message: stop moving. Stop demanding things from me. I am running out of fuel. This symptom is particularly dangerous, precisely because it is so easy to explain away. Everyone is tired. Everyone has a hard day. Everyone has moments where they feel drained. The distinguishing factor is the sudden onset and the disproportionate intensity. You did not run a marathon. You did not skip sleep. You walked up the same stairs you walk up every day, and suddenly you feel like you need to sit down halfway. That is not aging. That is not a bad night. That is a signal from a heart that is losing its blood supply. This warning sign confuses people because they expect it to feel like a lung problem, not a heart problem. The left side of your heart pumps freshly oxygenated blood out to the rest of your body. If the left ventricle, the heart's main pumping chamber, is struggling because its own blood supply is compromised, it cannot empty efficiently. Blood begins to back up, and the first place it backs up into is your lungs. The lungs become slightly congested with fluid. Not enough to drown you, not enough to make you gasp dramatically, just enough to make every breath feel unsatisfying. Like you cannot quite get a full inhale, no matter how hard you try. People describe it in ways that sound almost contradictory. I keep yawning, but I cannot get enough air. I feel like I just ran up 3 flights of stairs, but I was sitting on the couch. I tried to take a deep breath and it just would not go all the way in. Now here is the version of this symptom that should genuinely alarm you. You go to bed feeling fine. Somewhere around 2 o'clock or 3 o'clock in the morning, you wake up suddenly, unable to breathe. You sit bolt upright or swing your legs over the side of the bed, and within a minute or two the breathing eases. You lie back down, and it happens again. This has a name: paroxysmal nocturnal dyspnea. When you lie flat, blood from your legs returns to the chest more easily. If the heart is already failing to keep up, that extra volume overwhelms it. Fluid backs up into the lungs while you sleep. You wake up because your body forces you upright to shift the fluid back down. That episode is not a bad dream. It is not anxiety. It is the heart telling you directly that it cannot handle the load, and it needs help now, not in the morning. This combination of symptoms sends fewer people to the emergency room than any other on this list. And that is exactly what makes it so dangerous. When the heart is under acute distress, it activates the sympathetic nervous system, your body's fight-or-flight wiring. Adrenaline floods the system. Blood vessels in the skin constrict to redirect blood toward the vital organs, the heart, the brain, the kidneys. The result is a cold, clammy sweat that feels nothing like sweating from heat or exercise. Your skin is cool to the touch, your forehead is damp. You are not hot, you are not exerting yourself. You are sitting in a chair, and your body is drenched in a sweat that feels deeply wrong. At the same time, the vagus nerve, a long nerve that runs from your brainstem all the way down to your abdomen and connects to both the heart and the digestive system, gets pulled into the crisis. When the vagus nerve is stimulated by cardiac distress, it can trigger nausea, an urge to vomit, or a heavy sinking feeling in your stomach. This is why so many people in the hours before a heart attack are completely convinced they have food poisoning. The sensation in the gut is that convincing. Add dizziness. Cardiac output has dropped. The brain is receiving less blood flow. You feel lightheaded, unsteady, slightly disconnected. Now put the three together. Cold sweat, nausea, dizziness, no fever, no bad meal you can point to, no logical explanation. That cluster is a classic pre-heart attack presentation. And the reason it kills people is that the brain reaches for the simplest story first. I must have eaten something bad. I will lie down and it will pass. By the time they realize the story does not fit, the artery has closed. This one is subtle, it is not dramatic, and it is the warning sign that people are most likely to wave off as stress or too much coffee. In the hours before a heart attack, many people feel their heart doing something unusual. A flutter, a skip, a sudden racing sensation while sitting completely still. A feeling some patients describe as my heart flipped over in my chest. Here is the mechanism. Your heartbeat is controlled by electrical signals that fire in a precise, coordinated sequence. When part of the heart muscle is starved of oxygen because blood flow through the coronary artery has dropped, those electrical signals become unstable. The heart may fire extra beats called premature ventricular contractions. It may speed up without any reason. It may produce an irregular rhythm that you can feel thumping in your chest or pulsing in your neck. Now, occasional palpitations happen to almost everyone. Caffeine, dehydration, a bad night of sleep, emotional stress, those are usually benign and they resolve on their own. The distinction is context. New onset palpitations that you have never experienced before, a pattern that feels different from your usual skipped beat. Palpitations that arrive alongside any of the other warning signs we have discussed, the pressure, the fatigue, the cold sweat, the breathlessness. That combination is not caffeine. That is a heart under siege. And here is something that catches even experienced clinicians off guard. Some heart attacks, particularly in women and in people with diabetes, produce almost no chest pain at all. None. The only signs may be palpitations, an unusual tiredness, and a vague, persistent sense that something is not right. Patients describe it afterward with the same words almost every time. I just knew something was wrong. I could not explain it, but I felt it. That instinct is not paranoia. It is your nervous system picking up signals your conscious mind has not decoded yet. Trust it. This chapter could save someone's life more than any other in this video, because the people most likely to die from a heart attack are the ones least likely to recognize it as happening. The classic heart attack, crushing chest pain radiating down the left arm, is most reliably seen in one specific group, middle-aged men. That is the textbook presentation. That is the Hollywood version. And that is the image burned into the public consciousness. Women get a different version. They more frequently present with fatigue, nausea, back pain, jaw discomfort, and shortness of breath, often with no dramatic chest pain at all. The symptoms are real, they are severe, but they do not match the picture everyone has been taught to look for. So women wait longer, they second-guess themselves. They tell themselves it is stress or exhaustion, and they arrive at the hospital later. The data reflects this directly. Women are more likely than men to die from a first heart attack. Not because their hearts are weaker, because the system was built around a male presentation and the mismatch costs time. Diabetics face a different trap. Years of elevated blood sugar can damage the autonomic nerves, the network that carries pain signals from the heart to the brain. This is called diabetic neuropathy. When those nerves are dulled, the heart can be in serious trouble and the person feels almost nothing. Doctors call this a silent heart attack. It does the same damage. It destroys the same tissue. It just does not announce itself. Older adults fall into a third pattern. Every symptom gets filed under aging, fatigue, breathlessness, dizziness, must be getting old. That assumption delays care by hours, sometimes days. The message here is not that these groups should be more afraid. The message is that they need a wider net, not just chest pain. Every signal we have covered in this video. Now, I want to tie everything together with a timeline, because in real life, these warning signs do not show up one at a time in neat labeled chapters. They layer, they overlap, they escalate, and when you see them mapped onto a clock, the pattern becomes unmistakable. 24 hours before the artery closes, a mild fatigue settles in. Not the tired you feel after a long day, something heavier, something that does not match what you did. Maybe a dull ache in the jaw that lasts a few minutes and fades. Maybe a faint heaviness in one arm. You notice it, you dismiss it, you move on. 12 hours before, the intermittent chest pressure begins. It squeezes for a few minutes, then releases. You feel slightly nauseated, but you did not eat anything unusual. You sit down, the pressure fades, and you convince yourself it was nothing. 6 hours before, the symptoms stop taking breaks. Shortness of breath appears at rest. A cold sweat breaks out while you are sitting still. Your heart feels like it is skipping. The fatigue from the morning has deepened into something that pins you to the couch. What is happening inside the artery during this escalation is straightforward. The clot is growing. With each hour, it covers more of the remaining opening. Each wave of symptoms corresponds to a further reduction in blood flow to the heart muscle. The signals are getting louder because the situation is getting worse. Here is the point I need you to take from this. These warning signs rarely appear alone. They cluster, they build. If you experience 2 or more of the symptoms covered in this video within a short time window, especially if they are new for you, you are not overreacting by calling emergency services. You are reading a pattern your body is spelling out as clearly as it knows how. You now know what the warning signs look like. This chapter is about what you actually do when you see them. First rule, do not drive yourself to the hospital. If you recognize these symptoms in yourself or in someone near you, have another person drive or call emergency services. This is not about convenience, it is about survival. If the artery closes completely while you are behind the wheel, you lose consciousness and you take other people with you. Second rule, do not dismiss symptoms because they went away. We covered this. The intermittent pattern of unstable angina, pressure that comes and goes, is not a sign that you are fine, it is the warning itself. The fact that it faded means the clot shifted. It does not mean the clot disappeared. Third rule, do not self-prescribe. Do not take someone else's medication. There are clinical guidelines around aspirin in suspected heart attacks, but aspirin thins the blood. If the event is actually a bleed, not a blockage, aspirin makes it worse. That decision belongs to emergency medical personnel with a full picture, not to you in your bathroom at 2 o'clock in the morning. If you are alone and you suspect something is happening, call emergency services first. Then unlock your front door so paramedics can get in. Have a written list of your current medications, known allergies and medical history somewhere easy to find. A piece of paper on the refrigerator can save minutes that save tissue. And do this now, not during a crisis. Talk to your doctor in advance. Ask them directly, if I ever experience these symptoms, what do you want me to do? Knowing the plan before the emergency is the difference between acting and freezing. The 24-hour window is not a guarantee. Some heart attacks strike with almost no warning, but in the majority of cases the body sends signals. The people who act on those signals are the ones who survive with the least damage. Throughout this video, I have walked you through exactly what happens inside your body in the 24 hours before a heart attack, and how to recognize the signals most people miss. Knowledge is the first step, but there is a second step most people do not know exists. Right now, medical research teams across the country are running clinical trials on next-generation heart treatments, new medications, new diagnostic tools, new approaches to cardiovascular care that are not yet available in your regular doctor's office. These trials need real participants, people who live with real conditions and real risk factors, people exactly like you. If you qualify, the benefits are significant. You get access to treatments and monitoring that the general public cannot get yet. You work directly with specialized research teams who track your health closely throughout the process. In many cases, clinical trials cover the cost of treatment and related medical expenses entirely. And you contribute to research that will protect the next generation, your own children and grandchildren included. That is where Care Health comes in. Care Health is a free platform that matches you with clinical trials based on your specific condition, your age, and your location. You enter a few basic details, your name, your zip code, what you are dealing with, and it shows you active trials near you with clear descriptions of what each one involves, what the requirements are, and what the potential benefits look like. No medical jargon, no confusion, no obligations. The link is on my channel page. If you are watching on your phone, tap my profile picture at the top of this video to go to the channel page. You will see the link right there. A screenshot is appearing on screen now showing you exactly where to find it. If you are on a computer or a TV, a QR code is on screen. Open your phone camera, point it at the square, and tap the link that appears. 30 seconds.